The number one injury that I hear from soccer players that keeps them off the field is hamstring strains. And not just a hamstring strain, but chronic hamstring strains. Ones that just will not go away, and every time you try to get back out on the field, it becomes a problem again. With the World Cup coming to Houston this year, I, as a fellow Houstonian, am so excited to see all these soccer players coming and doing their best and showing off their talent, but I am a little bit worried about their hamstrings. So I want to educate you, as Dr. Christina, the Picky PT, about hamstring exercises you can do to prevent hamstring strains and make sure that you don't end up on the bench or resting while you should be training for your upcoming race or your upcoming soccer game. So if you like content like this, you think that content that teaches you about your own body and how to use exercise to prevent and reduce injury would be helpful for you, make sure to like and subscribe this channel so you can continue to learn from me, a doctor of physical therapy. So, like I said, I want to go over exercise ideas that are not your typical hamstring strengthening exercises that you might think that you would see at the gym. First off, I want to talk about the difference between concentric and eccentric strength. Now, we've talked about this topic before, but let's review again. Concentric strength is strengthening a muscle when it is shortening. However, eccentric strength is going to be strengthening it while it is lengthening. For example, your hamstring shortens and is concentrically strengthened when you are bending your knee. Imagine where the muscle starts down below the knee, where it ends up on your ischial tuberosity, which is your sit bone. When you bend your knee, you're bringing those two areas closer together, all right? But in order to make sure that your leg doesn't just flop down when you're done bending it, you have to have eccentric strength to control how quickly it lengthens. Now, why is this important for soccer players and runners? Well, for soccer players, as they are kicking that ball, if they have no control over how quickly they let that leg straighten, what happens is it's that muscle ends up tearing a little bit and getting pulled a little bit too hard as they straighten that knee with no control, all right? And when you end up with micro tears, and it happens over time repeatedly, you end up with what we call a muscle strain. There's 3 different grades of muscle strains: grade 1, grade 2, grade 3. Grade 1 is gonna be, you've got little micro tears, it's causing inflammation and it's causing issues, and you may have pain with kicking. Grade 2 is gonna be, you actually have a tear in that muscle. And so you may need to rest a little bit, allow it to heal, but then you also need to strengthen in a way that you are not going to let it happen again. And grade 3 is that you've torn it enough that you might even have to have surgery. So like I said, I want to keep you off the bench, I want to keep you off of the rest protocol, and keep you running and playing your favorite game instead of having to start over because of that hamstring strain. So we're going to focus on eccentric strengthening today, because that is, for the most part, what most runners and soccer players lack, and that's what leads to the most injuries in what I see. So we're going to do 3 hamstring exercises. 2 of them are going to be in kneeling, and 1 of them is going to be using a wall. So let's go ahead and start doing those now. So for this first exercise, you're going to need a TheraBand, and you're going to need an object that is not going to move, all right? I've got a looped TheraBand here, so I'm going to lock it onto this cable machine in order to do this exercise. Okay, there we go. I'm also going to use this dowel here for balance, so that way I don't fall over as I'm doing this exercise. So you could do this with a sliding pad underneath your foot, so that way you don't have any friction or resistance against the ground. I'm just using my socks. And then also, if it's painful for you to kneel on your knee, you can put cushion underneath your kneeling leg. You can put a foam pad or a rolled up towel or a pillow. It doesn't have to be on the ground like this, all right? So what I'm gonna do, I'm gonna put this here so you can see me better. What I'm gonna do is I'm going to back up enough that I already have resistance against that TheraBand, okay? I'm gonna slide my leg out, and then I'm gonna slide it back in, all right? So reminder, we're talking about concentric and eccentric strength. When I am allowing my leg to slide out and I'm controlling how quickly that happens, that is eccentric strengthening. When I pull that leg back in and I shorten the muscle, that is concentric strengthening. So usually people are more focused on the pulling in, but when you're doing this exercise, I want you to especially think about taking 5 to 10 seconds to allow that leg to go back out. So do not just let it go, okay, I'm done, right? You want to instead count to 5. 1, 2, 3, 4, 5, all right? And if you lack that eccentric strength, you may find that that band wants to pull you and it's really hard, and you might almost feel like you're like, stopping and starting and sputtering. That's okay. That's just weakness that you have. You're gonna work on that until you can glide nice and smoothly. 1, 2, 3, 4, 5, and then pull back in, all right? You're gonna go ahead and start with 2 sets of 10 of this. If that's easy, you can jump up to 3 sets of 10. If that's easy, you can instead do more repetitions, so 2 of 15, 3 of 15. But if you can do 45 of these in a row and you don't need a break at all, it's time to use a heavier band and make that resistance more. Couple more things to think about. Don't let yourself rotate in your pelvis as you do this. Don't let yourself lean all over the place as you do this. Make sure that your pelvis is in neutral. You're facing your leg, almost like your belly button is facing the knee of the leg that's straightening. And then you're gonna keep that pelvis facing that way as you go out and come back in. Go out and come back in with your foot staying in neutral, not turning out or turning in as you do so. So that's your first exercise. Okay, exercise number 2 is gonna be a progression of the first exercise. So this one's even harder, and you're definitely gonna want a dowel or some kind of stick that you can use to help you hold your balance and also help you if you need help getting back up, all right? Let's imagine if you've seen that dance move where someone's out on the dance floor and they kind of pop down into the splits and then they can pull back up, right? This is actually a hamstring strengthening exercise because you have to be able to use your hamstring to pull you back in, all right? Your hamstring isn't just involved in straightening and bending your knee, it also helps with pulling your whole leg back into your body. So for this next exercise, instead of straightening and bending the knee, we're gonna actually slide out like we're doing a split, and then we're gonna slide back in against the resistance of this TheraBand, all right? So again, we're going to have this leg straighter. We're gonna slide out. Don't have to go very deep, okay? I'm not expecting anyone to go fully down in the splits here, but then you're gonna slide back in and you can bend the knee as you come back in. You're really gonna feel this in your hamstring if you're doing this properly. Now, just like the first one, you're gonna avoid doing any kind of pelvic twisting as you do this or leaning to the side. You're gonna make sure that you start off squared up. Belly button is facing that front knee, okay? And it continues to face that front knee as you slide out. And then it continues to face the front knee as you slide back in. Good. So sliding out, this is the lengthening of the muscle, eccentric lengthening, and then sliding in is that concentric strengthening of the muscle. Again, starting with 2 sets of 10, building to 3 sets of 10, 2 of 15, 3 of 15, and if you can do 45 in a row, it's time to make this resistance harder, or it's time for you to start going even further down in that split and then coming back in against that resistance. So try out these exercises. Let me know if you're able to do them successfully or if you struggle with them. If they're causing pain, then definitely do not push through that pain. Make sure to see a neuromuscular expert, a physical therapist like myself, who can set up a personalized program for you and make sure that you understand how to use your hamstrings properly before you go on to super challenging exercises like this. If you have dealt with chronic hamstring strains, then I want to hear your story. When did that happen? How did it happen? Have you had to have surgery? Have you had to miss out on playing soccer or running? And what can we do to help you with that? So make sure to comment below or reach out to me. I'd be happy to discuss it with you.